আমার মনে হয় ফেসবুক লাইভটাও অ্যাক্টিভ হয়ে গেছে, দেখে নিন তো সবাই। হ্যাঁ, আমি রেডি, আমি রেডি, আমি রেডি, আমি রেডি। ফেসবুক লাইভও চলছে।
হ্যাঁ, আমি আছি অনলাইন। আমি অনলাইন আছি। Let's start.
Ladies and gentlemen, the friends, club of the IITHR, today evening, in a very auspicious evening for IITA, at IITA starts is for all program through the digital platform, and today program Dr. AMLAN KUSUM JANA, and I with few hours before I had a talk with Dr. JANA, and high expectation that I would like to show.
Samrat Paul from Ravindra, this esteemed members of your organization, and I would like to introduce Dr. JANA, who is a consultant psychiatrist and Institute of Cardiac Sciences. He is an associate professor at KPC Medical College, Kolkata. He was ex-senior resident at Central Institute of Psychiatry, Ranchi, and he has research and a keen academic interest on psychosomatic medicine. He has bagged many awards since 2004, like Indian Psychiatric Society, Indian Association of Private Psychiatry in the year of 2009. He has got award from Royal College of Psychiatrists, UK, 2013, and he has got award from American Psychosomatic Association in the year of 2015, and from World Psychiatric Association at the same year. So this is our consultant, Dr. JANA, and I would like to request Dr. JANA to take over this session onward. Thank you, sir.
Thank you, Samrat.
Over to you.
Okay. Thank you, Samrat, for your kind words. I was also looking forward to this meeting, and I always cherish these opportunities when we get to speak to people who are from different fields and professions, mainly because psychiatric services over the past 100 years, it has come out of those madhouses and asylums to common people. Psychiatrists in today's world are reaching out to more and more common people. It's not an esoteric discipline anymore, and people are appreciating more and more than that psychiatric disorders, psychiatric problems are indeed day-to-day problems. So here I am to discuss.
Can you
please switch up their microphone, audio, and video, please.
If you can unmute, mute the microphone, that will, okay.
Please mute your video and audio.
Okay, so today's meeting is about stress, and like we are experiencing now, every new situation puts us in some sort of stress because we have to adjust to the new demands. Like a video meeting, we never knew how to conduct a video meeting. I mean, we don't know. 2 months back, I didn't know how to conduct a video meeting. While conducting a meeting, many of us do not know what to do with our audio or video. See, all these sort of changes, all these sort of adjustments that is required of us. When we were young, we were school students, we could do it very easily. As we get old, we become more and more inflexible. We get used to our own fixed routine. And once there is a change, we are taken off guard. This is the source of stress. So without wasting much time, I'll get on with my presentation. So let's see if I think can everyone see what I'm showing? Right. So stress and its management. These are the migratory birds. They are hard to see these days, but I'll tell you why I'm showing the picture of migratory birds in my last slide. And gradually we are entering into what is stress. We all have a rough idea about what is stress. Some people think stress is something which is different from our expectations. Anything new is stress. Some people think anything uncomfortable, that is stress. Some people think anything unexpected, that is stress. So it's really difficult to say what is stress because it has a different meaning for different individuals. For me, it is a stress maybe to watch a whole movie in a movie hall. For another person, it might be a stress to watch a whole day of test cricket match. So it's different from person to person. Some people feel stressed out to face people. Some people feel stressed out not to see people, like we have been experiencing over the past 2 months. So stress has a different meaning for everyone, and one stress is different from another. But technically, it is actually an adaptive response to an internal as well as external threat. What is an internal threat? Physical discomfort. Like many of my colleagues, when they have to wear this protective equipment and go to the ward of COVID patient, they feel they're sweating, they're dehydrating, the heart is racing. That is internal stress, internal threat. What is an external threat? That you're going to a ward with COVID patient who might catch an infection. That is the fear. An event that can lead to an adaptive response. What can be the event? You have to deliver a presentation in the office. Many people get really scared when they have to present something. Or change. You come back home and you see something has changed drastically. Something drastically has changed. You don't have enough money to pay up for the EMI. You have to change your residence. And this change, threat or event is leading to some physical change in the form of, for example, sweating, racing heart rate, some psychological change like you're feeling irritable or you're feeling fearful, and some behavioral change like you're misbehaving, you're getting angry. So this in whole is a response to stress. The threat, event or change are called the stressors. Like a notice of a transfer, like anticipation of retirement, they are stressors. Stressors can be internal. Sometimes, way before the actual event happens, we tend to become very fearful just thinking about it. I have been transferred to Northeast. What's going to happen? Will the people there like me? This is an anticipation. We don't know. I don't know if I go to Imphal or if I go to Shillong. I don't know whether or not people will like me, but it will be wrong to assume that people will be hostile towards me. Why would they? If I take this assumption, then I'll feel stressed. Belief. There's a belief that if I take retirement now, I'll be bankrupt. Some people say you must walk after retirement. You must start doing a business. Attitudes. Attitude things come up, especially leading to stress in relational matters. What is your attitude with your junior colleagues? What is your attitude with your students or teachers or your spouse? They can lead to stress. And stressors can be external, like a loss, someone's death, tragedy, change. Now, what is an eustress? A eustress is the right amount of stress. Ask a student, when does he read maximum? Any average student reads and puts maximum effort around a month before the exam. The day before the exam, they're too much stressed. 2 months before the exam, they have no stress. So right around a month before the exam, the stress is eustress. This much of stress leads to positive response. Right. And what is distress? Imagine the day before the exam. That is distress. We feel that we haven't read anything. Everyone else has read up and we are at a loss. This is distress. If it's too high, stress is never productive. If it's too low, it doesn't have any good effect. Eustress is the right amount of stress. You know, there was an old proverb, don't whip the tired horse. You must whip the horse in the right way so that he runs fast and you're not going to make him tired. Stress is like this. Stress acts as a whip. If you can use it properly, it can make you productive. Now, what happens in our body? Why I say this? Because if you feel that you're stressed out, these are the things which will let you know, yes, there might be some problem in your adapting with the current stress. And you should seek help or maybe talk with your friends and relatives. Maybe you can seek professional help. Alarm stage. How would you know if there's an alarm stage? As we begin to experience a stressful event or perceive something to be stressful, there are psychological changes in mind and physical changes in body. And this particularly disturbs the normal body balance, body and mind's balance. What happens? What happens? Racing heart rate, racing respiration rate, like someone's panting, lowered skin temperature. This is something one doesn't usually, we tend to notice higher skin temperature in fever more than lower skin temperature. But lower skin temperature, as a doctor, we know that is a good indicator of change in bodily functions. Sudden increase in hormones, which lead to other changes in the body in the form of sweating, in the form of feeling to the need to urinate or defecate, headache. This sort of changes happen. Now, stage of resistance. This is the second stage when the body tries to regroup and make you ready to fight for it. During this stage, our body tries to cope or adapt to the stressors. Some sort of repairing of damage. This is the stage where everyone else notices. Maybe your spouse will tell you, you're getting too irritable, you're losing your sleep. Maybe your students will tell you, you're getting too irritable, you don't explain, you don't use humor in your teaching like you used to do 2 months back. What's wrong with you? This underlies the importance of social connection. The more socially connected we are, more safe we are mentally. Our mental health is always protected if you're socially connected. So this is where we have to examine our feedback, the feedbacks from our near and dear ones, including our colleagues, our friends, family members. Now, behavioral indicators. There are changes in behaviors. You can read it out in the screen. There are some changes in behaviors which indicate that we might be stressed out. Lack of enthusiasm for anything, everything. You tend to get withdrawn from your activities. The major change in eating habit, some people tend to eat very less, some people tend to eat very much when they're stressed. Lack of sleep, everyone must have experienced this. Sometimes, rarely, especially for obese people, increased sleep is also a response to stress. And fatigue, everyone must have experienced this. With the same amount of work, you'll feel too tired if you're stressed. The changes in your thinking pattern, poor problem solving. Any problem in office, you tend to feel overwhelmed. Any problem at house, you tend to get irritable. There's confusion, cannot take a decision. Nightmares, hypervigilance, you're always alert. A small sound, you tend to get alarmed, as if you're on the edge. You're sleeping in a jungle and you're fearing, as if a tiger might come and eat you up. This is the alarm response. Our body is tuned to it to face danger. When there's a real danger, you won't get any sleep. Imagine people 10,000 years back in the jungle. If they're not guarded, they won't get sleep because they know that the animals might come and eat us up. Now in today's protected world, all these sort of fears, they're imaginal. So whenever there is a stress, you tend to feel there might be danger and you can't sleep. Not being able to relax is a very, very big problem in today's world because everyone is thinking about what's going to happen tomorrow rather than take it easy at night and get some good sleep. So this is a good indication if one is hypervigilant, very attentive, very alert when it is not required, probably is under stress. Now, stage of exhaustion. This is when the body gives up. There, all the physical symptoms come up, one goes to the doctor. But by that time, the person has suffered a lot from the stress. Indigestion, very common. Headaches, tension, lack of sleep, loss of temper. These are some very few examples. There are many things which can happen in body. Now, I would like to ask a question. Since it's a Zoom meeting, this was designed for a general meeting. I'd like to deliver this lecture later in proper setup so we can talk while I'm presenting. So, how many of you think that stress is good? I'm not taking an answer for this because most people think stress is not required. But that is, unless you face stress from early in your life, you do not get the skill to deal with stress. And that puts you in a very, very difficult position. This is something we teach our MBBS and MD students. You must face stress while you are in training period because when you'll be working independently, deal with it all by yourself. If a child faces stress from his early ages, guide him how to deal, and that is the best thing one can get from parents. It sets the tune about how he's going to behave to office, when he goes to college, when he faces domestic, up to a certain. So this is the curve. When you cross the peak, see, left half of the column, left half of the graph, more stress the better. Right half of the column, more stress the worse. So up to a certain point, stress is good. Beyond that, when the body is exhausted, mind is exhausted, stress doesn't do any good. So this is how stress is linked with our performance. You do need the right amount of stress. Of course, the right amount varies from person to person. So that brings us back to the old poem by Tagore. I'll use the Bengali words. Bipode more rokha karo nohe ami na jano kori bhoy. We have to raise ourselves so that we can deal with the stress rather than praying to the God save me. make me prepared so that I can face the dangers. So this is about what we are to do about management of stress. So I'll move on to the next slide. What happens when we are stressed to the people who are around us? These are called ripple effects on spouses and family members. Careful and guarded, they are of course very careful about us. Little talking or sharing, resent job, spouse, or both. The person who's stressed, he resent about anything. He doesn't like his job, he doesn't like his spouse, he doesn't like his family, he doesn't like increased unproductive arguing. Arguments are good when it's done with a cool head. If you do an argument, it leads nowhere. Fear for family and a stressed out person feels that's going to happen in a single day, but he fears so. Little talking or sharing, lifestyle, interest, use of problem methods. I'll give you a single example of problematic coping is you're not getting sleep, taking alcohol for it. You're getting irritable, you're getting tense, taking alcohol for it. Smoking, all these things. They actually go on to increase the stress, but no one understands it. So this is problematic coping. We are stressed for a long period. This is what happens. Leave their parents, always try to stick to them. They're withdrawn, uninterested. Acting out means some of the things which are there in their mind, like hitting. They might say that I'll hit you if you tease me. But if we are stressed, they might actually hit you. They'll do things which they wouldn't have done. Some of the actions come out from their thinking level, slang, like hitting people, all these things. There are disturbances in sleep, eating, some bodily complaints in the form of headache, stomachache, moral leads to around 3 days of absenteeism from school. If the parents are stressed out, the child will take a longer leave. The school performances will decline and they become anxious at the absence of their parents. So they cannot stay in school and do well. Now, management of stress. This is also something which varies from person to person. There's no single pill for stress management. And if you go on to look into the Wikipedia, this is the list. Exhaustive, one cannot do it. Many things. Autogenic training, you train yourself to relax. Social activity in the form of gossiping, in the form of chatting. Conflict resolution, exercise, spa, spending quality time with pets, many things. Not all of them are scientific. But there are some things which are scientifically proven. I've marked it in red. Cognitive therapy, relaxation techniques, and time management. I'll discuss a little bit about each of them. They are professional things, but yes. Can everyone see this? Just a minute. Can everyone see the slides? Someone has written that it's not being. Yeah, I'm sharing it. I'm sharing it again. Everyone can see the slides?
Not right now.
Okay,
Screen
okay.
sharing is off.
I've just put it on hold. I'll share it again. I'll share it again. Right. Can everyone see the slide? This slide?
Yes.
Okay. So as I was saying, there are a lot many things that people suggest about stress management. I'll discuss three of them, which are something that we do actually and we suggest, and we find it easy for everyone to do it. So let's move on to this stress management. First thing about stress management is self-observation. Try to find out what is wrong and what are the changes in you ever since you feel you have been facing a stress. Next is cognitive restructuring. I'll come to it in my next slide. There's some sort of thought process which goes on in our mind, which are actually assumptions and not right all the time. We need to find them and rectify them. This is very important. For example, I'll share more about this and explain more about it. For example, in our times when we were young, it was a common thing for many students to feel that they're weak in mathematics. I don't know why. Many of them had done very well in later years, but initially in between class 1 and 4, they used to think they were very weak in mathematics. These are assumptions. Someone told them you're very weak in mathematics, and they have put it in their mind. These are assumptions. It doesn't help. Relaxation training, time management, and problem solving. I'll discuss all these things briefly in our next slides. So, do you actually think stress is just what we consider it to be? Many psychologists across the world, they think the stress is actually perceived stress. There's no absolute stress. What is considered stressful by me, someone else might just laugh at it. And what is considered by stress by someone else, I might think it's not stressful at all. So they call it perceived stress, how we perceive it. For each stressful event, find out the antecedent. Briefly describe the stressful event and rate it along a score of between 0 to 100. Like transfer of old boss and arrival of a new boss from Coimbatore. You score, this is a very highly, for my office, if I have a South Indian boss, it's going to be, I'm going to be really in a difficult situation. You rate it 70. Behavior, thoughts, feelings, physiological response, and your behavior. These are the things that you notice in yourself. And then consequence, you took a long and untimely leave. I cannot face him. I've heard he's very strict. I cannot face him, and you take an untimely leave. This is an example. This is a very rough example. Might not be very, appropriate for your profession. But I just tried to show what happens if one is facing stress or anticipating stress. Now, self-observation. It helps subjects to notice some automatic behaviors. Missing out on office parties, arriving at those parties really late when most people have gone out. You unknowingly are avoiding your colleagues and office situations. So if you observe yourself, you see how intricately our thoughts and behaviors are linked. Because you are worried, your behaviors have changed. Your friends are noticing it. I would suggest that you start noticing it if it's happening. That will help you. It shows from previous records of stress and its response that effective coping strategies are indeed helpful. If one is making note of these changes, he will find out that 5 years back when similar thing happened, I did all these things and it didn't help. Maybe this time I'll do it better. Now, cognitive restructuring. I was telling you a little, I mentioned this a few while back. How would you change your thinking? Like any negative emotion, if excessive or prolonged, has to be distorted or dysfunctional. See any negative emotion, anger, anguish, sorrow, despair, frustration. If it's prolonged and excessive, there has to be something wrong. This is a general rule. So cognitive appraisal is about we have to appraise how we evaluate stress. And secondary is how evaluating what can be done about it. So first you put a score on how much importance or how much severity you're going to attach to this stressful event. And next level is what are you going to do about it. So this is how you organize your thought. We call it cognitive appraisal. Next, monitoring and analyzing dysfunctional thoughts. For example, you already assume the new boss from Coimbatore has anti-North Indian bias. This is very common. I mean, this is very common in many institutes. People have bias about which part of India you're coming from. Even if people do not have that bias, many people think that he's coming from Haryana. He might not be liking the Bengali people. He's coming from Kerala. He must be hating the people from Delhi. Might not be a fact. What you're doing, you're having fear or anger without any substance. You challenge the thought. Why I'm getting angry? Why I'm getting angry because of the fact that this new boss is coming from South India. You challenge this thought and then try to modify it, change the thought gradually. It sounds quite theoretical, but clinical psychologists, they take sessions and do this. Many of you must have heard about cognitive behavior therapy. It's very effective psychotherapy in depression. This is how they do it. This is not easy to do, but they do it. They help you do it, change your thoughts, challenge your thoughts, and show you how your thought is affecting your behavior and how a change in behavior will indeed make some changes in your thoughts. Now I come to an easier exercise. Apart from cognitive restructuring and changes in your thinking, relaxation training is somewhat easier to understand and do. Literal meaning of relaxation. Sometimes it is linked to relaxing the muscles of our body, from toes and fingers to limb muscles and trunk muscles. You lie down, concentrate on a group of muscles, try to relax them, try to gradually relax them. There are different modes of relaxation. One is Jacobson's progressive muscle relaxation. You'll get all these information in internet, and clinical psychologists that do it very effectively. The concept is when we are stressed, our muscles, if we can somehow make our muscles relaxed, the receptors in muscles, they send a signal to the brain. That's it, muscles are relaxed. So there's no need for the brain to become hyperactive and release all those stress hormones in the form of adrenaline, noradrenaline. So hormone secretion tends to slow down. That leads to a slowing of this heart rate. On the face of stress, heart rate goes up to 120, 130 beats per minute. With this relaxation, gradually body tends to become slowed down. We can do differential relaxation in the form of, you can do legs at a time, but not of hands. And we can do whole body relaxation as well. There are some other which are being done in corporate setup. They say in many Western offices, they have a set point of, they have set some time, 45 minutes for meditation, yoga, relaxation. There they practice these things. Many practice 30 seconds of relaxation exercises in a span of 1 hour. 30 seconds of relaxation, you do 10 minutes of other exercise or other work. Then again 30 seconds of relaxation. People do it. They find it. Now, coming to time management, this is very interesting because time. But still, we tend to make some sort of mistakes. Important thing for us to know is awareness of the current pattern of time use. We know how we use time, but we are not always aware. You come back home, as I've written in the slide, is turned on, watch it. You do not like it, but still you have energy to turn it on channel, just watching it nonchalantly. This is a waste of time. You're not. Your body is not getting the relaxation because you're getting the TV, but you're not enjoying the TV program either. This is an example of silent waste of time. Now, lost opportunities of enjoyment. I'll give you two examples. You are stuck in a traffic jam. You're cursing everyone. Why there is traffic jam? You cannot get out of the jam. You have to wait there for 5 minutes. Rather than cursing, why don't you listen to a song that you like? Next, you have, rather than cursing, why the current will, it's you see a super cyclone. This is very common. I've seen many people do it. Okay, rushing to petrol pump with the news of price hike, saving a maximum of rupees 200. Petrol price will be increased from tomorrow. Enjoy. Lose the time. We do not track our activity and we do not plot according to priorities. Okay. Goal setting. What do you want to do? Set a goal for next week. Analyze the goal to see if it is reasonable, specific, and carries a personal meaning. Not all works are related to earning money. Some works are related to spending time with your family members. So this is how you set your goals. Reconfirm the time frame. Make it 10-12 days if required. And review your own efforts. Am I doing better than last week in terms of setting the goal and achieving the goal? Now, problem solving. You identify the problem, you generate the alternatives, what else can be done? You evaluate the alternatives and select the best solution, and you implement the solution. This is a common thing that everyone does in his or her life. But sometimes you need to just work on doing as good. Some more tips about stress management. Let's see stress as something which we can handle rather than something which rules us. Let's build our physical reserves through regular exercise, healthy and nutritious diet, adequate sleep. Remember, for anyone who's over 40, adequate sleep is very important. Avoid the quick fix solution in the form of smoking, drinking, excessive caffeine, and build emotional reserves in the form of friendship, hobbies, creative activities. So when do I go for professional help? The common thing is if you feel that you cannot handle it, psychologically you're very anxious, very distressed. Physically you are losing your sleep, you're having indigestion, you're having headache, then you seek professional help. It varies from person to person. But best person to go to first is your friend or your spouse or anyone you feel you can discuss openly. Now, we cannot, and believe me, we do not want a life without stress. It's not that interesting if you have a life without stress. So to conclude, the goal is to reduce stress in life and not to eliminate it altogether. And stresses do remain despite our efforts. We actually get stronger to deal with them. So let's not pray, Bipade more rukkha karo. Let's pray that God, please make us stronger so that we deal with stress better. So this is a migratory bird. You see, they come from a place where the temperature is minus 30 to our place where the temperatures are about, in December, it's the highest temperatures are about 22, 25 like that. So they can endure a difference of 50 degrees Celsius without anything. They don't have any special organ. They don't have any cotton pad, anything. But they can adjust to it. Human beings migrated from eastern part of Africa to cold places like Alaska and survived without many things that we have today. We can do a lot of things. We can do many things. Our body and mind can adapt to many things. We just have to believe in that. We have done it in the past. Why can't we do it now? So I'll end my presentation with this quotation by one of the famous film directors. There's no end, there's no beginning, there's only the infinite passion of life. Feel interested in what you do, feel interested in your life. Share your interest with others. You'll definitely enjoy. You won't be bogged down by stress. Thank you for your time and patience. Okay, so that concludes my presentation.
So we have some questions.
Yeah, sure, please.
Yeah. The first thing I would like to mention is that you told about what is called that perceived stress, and you also told about cognitive restructuring. But I want to know how to deal with cognitive restructuring when there is a force majeure situation, when there is a huge pandemic, people are losing jobs, these migratory laborers, they are not being supported by government. How to deal with this type of stress? This is not a perceived stress, this is actual stress.
No. See.
Okay, and just let me complete. Sir, my second question is, you told about silent loss of opportunity, like watching a boring TV after getting back to home. But if it is always not a silent loss of opportunity, there must be a different perspective to it. A person who have a very tough day in the office, he may come to home and enjoy the TV with his wife. So there might be a different perspective to it. It is always not a silent loss of opportunity.
Right. So I'll try to answer the second question first. If you feel that what you watch in the TV is something you enjoy, then it's definitely not a waste of time. Sometimes we watch TV without enjoying, just not feeling energetic enough to change the channel. That is an example of silent loss of time. But when you come back home, you watch something in the TV, you feel relaxed, you feel charged up, that is definitely not a waste of time. No loss of time is done in enjoyment. So
no, I'm not saying that. I am saying that the TV the TV serial might be boring to you, but sitting beside your wife and watching the TV with her may make it some relaxation after a tough day in office.
If you feel you are feeling relaxed, then it is not a waste of time. Sometimes after spending the time, looking back, we felt that I shouldn't have done this. I mean, that was a waste of time. If you feel that you wasted time like that, then you might make some changes. If you feel that I'm not enjoying the TV, but I'm enjoying sitting beside my spouse or my children, that is good enough. If you feel it's good, then it's not a waste of time. Number two, the first question is more important in today's context. In the face of pandemic, in the face of crisis that we see today, real loss of job, real loss of economic disaster. When I say perceived stress, the example would be like, in the face of pandemic, not everyone is needing a psychiatric help. You'll see, on a common stressor, 5 people will have 5 reactions. Some of the people will react more in terms of anxiety and depression. Some of the people will keep their head cool and decide what best I can do in this disaster. So my goal is to tell you that in the face of real danger, real problem, we have to perform what we should do. There is a problem, but if we lose our sleep over it, it's not going to help us. So we have to reassess. What can I do in the next 1 week? What can I do in the next 1 month? How can I keep myself fit physically? How can I keep myself fit psychologically? And you have to do accordingly. Despite doing it, the stress might not change, but at least you won't succumb to it. You are not going to have a depressive episode if you do it right. And we have seen from our experience, all stressors, they come and they go. Nothing stays for our life. Everything, tough times, there's a saying, tough times never last, tough people do. It's about making ourselves tough and doing it right in a difficult situation. It's not going to change the stress. It's going to change you, keep you afloat. That is the point. More questions?
It's a nice presentation indeed.
Thank you.
In fact, I have a little interest regarding your deliberation. Can you hear me, please?
Yeah, sure. Please carry on.
Yes.
Being in the adverse circumstances, does it enhance your psychological stress-bearing capacity or, the physiological stress-bearing capacity under the adverse circumstances? Please.
Okay.
It is
So-
just my sheer interest only.
No. It is a good question. I have mentioned that is stress good for us? See,
Yeah.
it varies from person to person, but every psychiatrist or psychologist believes across the world that we need to face stress from early in life, but not in a very high magnitude. Unless you face stress, you cannot prepare yourself. You cannot make yourself strong. So stress can lead to psychological strength. Stress can lead to physiological strength. See, the best example is our education system. If you take out the stress in the form of taking out the exams, students do not do well. We did study because we had exams. Exams were stress points, but because of the exams, we did study. We became better in class 2 in terms of knowledge than we were in class 1 because they had an exam. This is a rough example. Stresses do make us better, stronger physically and mentally, but it has to be tuned to a way that it's not too much for us to handle. So it should be eustress, as I was discussing. It should be optimum, not too much and not too less.
Right. When you're in the development of stress, naturally your body, your mind starts dysfunctioning. How to get away with it?
I missed it. In a difficult situation, our body and mind is not functioning well. Then what is your question?
Right.
Can you please ask the question? In a difficult situation, our body and mind is not functioning. What to do then?
Right. In that case, how to get out of this particular this situation so that at least you can start functioning.
Actually, there's no specific answer to that. What as a doctor we suggest is first you look after things which lead to your smooth body functioning. If you are losing your sleep, you have to get your sleep. Your doctor can help you.
Right.
If you are feeling weak, though it sounds strange, but if you're feeling weak, you have to do some sort of exercise. You look into your diet. The moment you start to get proper sleep, that is the indication that body is coming back to function. Once your body is better, once your body is restored, your psychological well-being will also come. So first look after all those things which have changed in your body in the form of lack of sleep, lack of appetite, lack of strength. Put some effort. Maybe you can take help from your physician, the family physician, and restore those functions. Once your body is better, then gradually your mind will also follow. If it doesn't, you can take professional help, a few days of psych counseling or medicine, and then you can come back to yourself. Usually the common man's goal should be nutritional diet, moderate exercise. These two are very important.
Right. In fact, I have got so many experience of people in my kith and kin that they used to get some sedative drugs, particularly when they want to come out, when they want to relieve themselves from some psychological problem. So those drugs are so sedative in nature that they do not come out from their, sleeping pattern, for so many days. Okay, they used to sleep. Yeah.
Okay. So my general advice, and all doctors and all guidelines, international guidelines say, if you have to take sleeping pills, it's not recommended for everyone. If you have to take it, it's usually not good to take it for more than 2 weeks. People tend to carry on with his sleeping pills. They are not helpful in the long run. And try not to take sleeping pills. Exercise is better. Exercise is much better to get you sleep.
Thank you very much. Thank you very much.
Hello.
Yes.
Hello.
I'm listening.
Yes. Shota, please. Hello, please quiet. Please, Shota also take the hands and I have to allow him before you speak. Shota, please ask him
Yeah.
question. I have to close the session.
Yeah, I have an observation in life, regarding this stress and performance graph. Doctor, you had a great presentation, but this is a little bit exceptional observation I just wanted to share with you. The true heroes in the world, for them, the graph with some amount of stress, the performance is going up. And after it is reaching a maximum point, it spikes. It doesn't take downturn. Rather, it goes up. Although their physiological biochemistry is not very congenial to withstand the stress. This is an observation. This is my personal experience.
No,
I think everybody should aim for that.
Right. I mean, I cannot really disagree with you, because what you said is absolutely spot on. But as you mentioned, there are exceptions. We as common people cannot match their mental and not always physical, mental ability in our real lives. I know of a soldier in Indian Army whose abdomen was cut open, and he was holding his intestine on his hands, and he ran 1 mile to reach the hospital holding his intestines. Can you imagine it? Holding his intestines, he reached the hospital, described his problem. He was not in any shock. He forgot his pain, everything, and came to the hospital. And then he was operated, he was saved. But the treating doctor told me that this is something which, as a doctor, he could not believe his eyes. A man can endure this much of pain. We've heard about in history, we've heard about Napoleon, who could stay on field and on his horse nights on end without sleeping. They are really exceptional. Our discussion about stress management is about what we can do in our common lives. The exceptional people, their mental ability, for some people the mental ability, for some people the physical ability, they defy the laws of physiology. They defy the laws of psychology. And that is why more stress, more productive. More pressure, more deliverance. That is something unbelievable for others. Definitely not for me to, tell others to follow. But one has to make his or her own adjustments regarding how much stress he or she is going to take. But this is indeed a very nice point.
Good evening, Dr. JANA.
Good evening.
That is extremely useful liberation. In fact, it's highly beneficial for all of us who are in the industry, which is really in a terminal condition. Thank you very much. I have a very simple question before I give thanks to everybody. That this stress-bearing capacity of a person depends on which factors?
One factor just came in mind, and what I am also thinking sometimes, maybe I will apply to my child if you agree, that if you take more stress from your childhood or school or college, gradually more stress if you have by any means, due to your family, due to your financial condition, due to your society, if you are taking more stress from childhood, is it fact that you will be able to more absorb the more stress in your mature life? Is it a fact or that's my
See, it is right that we have to expose our children to stressors. I'll give you an example. Suppose we are taking our children to cricket lessons, and you want them to learn how to hook a bouncer. If you want them to learn how to hook a bouncer, they must be wearing helmets. So this is about stress. You want to expose them to stress, you must have the means to help them how to deal with it. We used to have helps from our siblings. Today, most of the children do not have any sibs. We used to have helps from our teachers. Today, the teachers do not talk with the students privately. So there's a problem in today's world. Our children do not have a real friend outside their own. I mean, they are more engrossed with their laptops rather than playing with friends. To deal with stress, one must have a good social connection. So I would suggest to every parents to see to it that they are well connected socially, friends, relatives, family members, and then gradually expose them to stress so that they get the cushion. This is how we can help them. Not just the stress, also the solution in the form of social connections.
Okay, Doctor, now I have 1 minute left. I will request our joint coordinator, Kaushik Bhuya, to set up your vote of hands. And also, I understand a lot of people, they have a question, but we cannot take all the questions because the time is limited and we have only 1 minute left and we have to conclude with the vote of thanks. And I will now request Kaushik Bhuya to say a few words and conclude the session. Kaushik Bhuya.
Ladies and gentlemen, thank you all for your participation and making our first webinar a successful one. I would like to thank Dr. AMLAN KUSUM JANA for taking out time from his busy schedule and deliver such an excellent speech on stress management, which will be very helpful to all of us. Our sincere gratitude goes to our co-organizer of this webinar, RN Tagore Hospital, and especially to Mr. Samrat, without whom this could not be organized in such a successful manner. Thank you all. Good night.
Okay. It was my pleasure too. I have shared. I'll share my presentation if you want, and I have my email address given. So if you have any question, you can mail me later. If you have any specific question, I'll be happy to answer them.
Yeah, Doctor, I already told you that we are regularly publishing the journal.
Okay.
So
Okay.
you have to, and you please send your lecture to us.
Okay.
I have given my email ID. Please send
Okay.
me.
Okay. I'll do it. I'll do it. I'll do it. I'll do it.
We will do this type of seminar off and on because we are always under stress. So I hope that you will also participate in our next session or something sometime.
Okay. Okay. Thank you. Thank you.
Thank you very much. Thank you very much for all of you for participating in this first digital platform Health for All, and this is the dream of our